name is Cassie Adams, and this is my abdominal assessment for advanced assessment with Professor Marsh at University of Charleston. Hello. So we're going to start by observing the abdomen, and it is symmetric. I do not see any marks, any discolorations, no striae. I do not observe any peristalsis or aortic palpations. So we're going to move on to auscultation. Listen to your belly, okay? First, we're going to start by listening to all the bowel sounds in all four quadrants. Bowel sounds are positive in all four quadrants. So now we're going to listen to the arteries in the belly. We're going to listen to the aorta, the renal arteries, the iliac arteries, and the femoral arteries to listen for bruits. The aortic artery is found halfway between the sternum and the umbilicus. No bruits heard. The renal arteries are about an inch from the aorta on either side. No bruits heard. The iliac arteries lie below the umbilicus on either side. And last, we're going to listen to the femoral arteries. No bruits are heard over either one. So last, we're going to listen for a friction rub or any venous humming over the liver as well as the spleen. No humming or friction rubs heard. So next we're going to percuss the abdomen in all 9 areas. I'm going to percuss now, okay? Tympany is heard in all 9 quadrants. So now we're going to find the liver and measure the span of the liver using percussion as well. Seems to be roughly, I don't have anything to measure, but it does seem normal size. Next, we're going to find the spleen and percuss that as well. The spleen can be found from the axillary line down to the last intercostal spaces. I hear tympany, so there is no splenomegaly there. Next, we're going to do palpation. We're going to start with light palpation, and then we're going to move to deep palpation, okay? We're going to palpate all 9 quadrants, or all 9 areas of the abdomen. Any tenderness? No tenderness noted. No abnormalities or masses noted with light palpation. So we're going to move on to deeper palpation. Go a little deeper this time, okay? You let me know if there's any tenderness anywhere. Any tenderness anywhere? No. No tenderness noted, no masses noted on deep palpation. So now we are going to palpate the liver for any masses. So we'll come up over here to the right side of the rib cage, palpate for the liver. Also to see if it is enlarged or inflamed, and we cannot feel the liver, so that is a normal finding. Next, we're going to feel for the spleen. And you would come to the axillary line, and you're going to move your ribs up and palpate there to see if you can feel the spleen. You cannot. Next, we're going to feel for the kidneys. And those are, again, mid-clavicular line down underneath the rib cage. We're going to get the other side, mid-clavicular line. And I do not feel either one, so that is good. That means that there is no enlargement. So next we're going to move on to the aortic, and we will find the aortic with our fingers and pinch between and hold between to check the width of the aorta. And of course, if you have a patient with aortic pulsations, you will not palpate the aorta or pinch the aorta. Next, I'm going to have you sit up, if you will, and we're going to check the CVA or the costovertebral angle. I'm going to thump you on the back a little bit, okay? All right, you ready? Does that hurt?
No.
Does that hurt?
No.
Does that hurt?
No.
Okay. That hurt?
No.
Does that hurt?
No.
Does that hurt?
No.
Okay, go ahead and lay back here. So now we're going to check for any ascites. So we will palpate the abdomen again, and we'll be looking for a fluid wave or a fluid shift. He does not have one on either side, so that's good. Next, we're going to check for appendicitis. So we're going to put pressure over here on the left side of the abdomen. Does that give you any pain over here on the right?
No.
So there is no pain here on the right, so his Rothstein sign is negative. Next, we're going to do the SO sign, and I'm going to put pressure here. And can you lift your leg? Try to lift your leg up. Does that give you any pain here?
No.
Okay, so that sign is also negative. Last, we're going to do the obturator. We'll pull your leg up. We're going to internally rotate, and I'm going to ask you to cough. Any pain?
No.
Okay, good. Lastly, we're going to check the Murphy sign for cholecystitis. So we would find the bottom of the rib cage, and we're going to feel around the liver and up underneath there for the gallbladder. We're going to ask him to take in a deep breath as I deeply palpate. Deep breath. Any pain? Okay. So the Murphy sign is also negative. That concludes our abdominal assessment. Thank you.